I just had the opportunity to meet Ethan Minh, and his booth is right next to us, and thankfully they've allowed us to set up here. Ethan, welcome to the Technology of Beauty.
Thank you for having me.
It's a pleasure. And I'm going to have him back on the show, but I'd like us all to get to know him a little bit more and also understand a little bit more about this whole concept of exosomes. I don't understand exosomes that well. And there's a number of companies that are bringing this to market. And down in Octane, Newport Beach, just recently, the winner of one of the big awards was a company that's involved in exosomes. And I've been told this is the future, regenerative medicine and exosomes. So thank you very much for coming here today. First of all, well, welcome.
Thank you so much. I'm glad to be part of.
Great. Where are you from?
Well, we're based in Orange County, California.
Fantastic.
Yeah.
That's right up the road from me.
Yes, but I'm personally from Korea. I was born and raised. I moved out to the United States when I was 25.
Okay. Did you come out for school?
I came here for school, yes. I went to college in Chicago, and then again, I settled in Orange County after school.
Well, that's where I'm from.
Yep. Thank you.
Terrific.
Let's be
well, that's wonderful.
From our town.
Absolutely. Okay, so tell us about your company. What's it called?
It's called Benev. It's the short words of beneficial evolutionary or word benevolent.
Okay.
And then Be Next Venture. That's the words that kind of goes back of how the actual brand manager came up with the name Benev. But it actually talks about the characteristics and the vision of the founder, which his name is Mr. Minh. He's my uncle.
Okay.
So I am the nephew of Mr. Minh, who founded the company in 2000 in the United States.
Fantastic. And what do you produce, or what is your product?
So we are a FDA licensed manufacturing facility, basically based out of Orange County. So our main manufacturing product is skincare and topical drugs.
Okay.
That was from the very beginning. Since 2014, I became a president of the company. I changed around the company's vision and how we want to move forward with our company in the aesthetic field into a company who can introduce a innovative technology from Asia to U.S. market and innovative product in U.S. market to Asia. Because that's where
both
I feel...
directions.
Yes, both directions.
Okay.
Because I feel confident that I have enough of a network, being in the industry for 17 years in both ends, working closely with some of the U.S. network, with American doctors, plastic and derms, and again, a lot of cosmetic surgeons, as well as the doctors that are in aesthetic field in Asia. And also the company, I'm not a doctor. I major finance. So I'm far from scientists or medical doctors, but I have a lot of network of people that I know of that are not a doctor, but in the industry.
Okay.
Basically for the purpose of generating profit. And also, I've personally felt like I wasn't fitting in and I wasn't ready for this type of stuff, but again, I found this industry fascinating, very innovative, fast changing, and obviously we talk about beauty, right? And aesthetics.
The technology of beauty.
Yes.
That's what we're here talking about.
And then again, obviously you got to talk about health, beauty, and also longevity and sex, and all part of this whole beauty segment, and which I felt this is pretty fascinating. And then again, I love working with women, obviously, and they're full of women that are in the industry that I felt that I can fit really well, and then again, associate really well. So that's probably the reason why I'm still here where I am, and then again, continuing what I'm doing.
Okay, so your company provides exosomes, correct?
Yes.
Well, why don't you tell us briefly what exosomes are? But only you have less than 5 minutes, because I want to go further into this.
So you really have to bring growth factors before you talk about exosomes. And then again, what's inside of exosome is separate subjects, but our base, obviously, and my technology start with the growth factor technology.
Yes.
Benev has been a manufacturer of growth factors since 2008. We were researching about growth factors since 2004. So about the time that Skin Medica and all the other companies came up with the growth factor products, their focus was to come up with a physician dispensed skincare line.
Yes.
That doctor would sell off the shelf.
And that was
patient.
TNS.
TNS recovery. Our focus was a little different. Our focus was really more for providing a providers, which is the doctors, a solution maybe they can utilize at their practice. Because we were making a post-care kit and then post-care for a lot of resurfacing devices, a lot of laser devices, that they will let the patient walk out of the door without putting proper post-cares. That's going back in 2005. We thought if we understand the therapeutic potential of growth factors, if you make sure that physicians understand that post-care starts when they complete their procedures, if you can convince them that there's a skincare product you can use to make sure that patient walk out with a proper, right, post-care starts immediately after the procedures.
Okay, a number of companies have done that.
Yes.
This is not. I asked you about exosomes.
Yeah. So that's
many companies have done post care. Okay, that's as old
so
as.
the growth factor was the ingredient that I chose to do so, but we did not come up with a product that sell to the patient. We're the first one came up with a product that physician uses at the clinic that we would not sell it to the patient, because as you said, a lot of company came up with the products that they are selling to their patient so that they can maintain at home.
Okay.
Right? So that was the first focus. So what it is like this is a skincare solution they use as if this is a drug. It's not a drug, but explained by physicians and importance of post-care. And obviously growth factor has a lot of story. Right? Now, moving to the exosome. The growth factor is usually produced by the cell. Right? If you go through a certain culture process, right? Cell usually releases it as you proliferate. Right? They would filter out the cell, right? They'll extract the growth factors from the culture process. And that's a TNS recovery. What they did is basically they put the conditioned media, which is the remainder of the medium after you filter out the cell. They'll put that into the cosmetic product, put it in the cosmetic bottle, make a formula and sell it to the patient, right? So exosome is, in essence, very similar. Exosomes are being produced during the cellular proliferation process. Your cell, I don't care whether it's a stem cell or fibroblast cell or epithelial cell, as you proliferate, right, it releases certain factors. And again, growth factor is definitely one of them. Exosome happen to be treated as a waste basket. Basically, the cells are releasing. What they found out in 2009 is that it actually contains, right, exosome itself, we thought it was actually the waste basket, contains the growth factors as well as cytokines. It's a whole different package of components that cell releases that are captured in the bilipid membranes being released from. What it does, exosome are basically a messenger to cell-to-cell communication. Growth factor is also messenger. Growth factor is more of a texting type of messengers, but exosome is more of a visual, virtual, let's say Zoom messengers. It brings so much more information at once. It really helps cell to basically communicate better.
Okay. So, I don't mean to cut you off.
No, it's okay.
There are a number of companies with exosomes.
Yes.
What makes your exosome technology different or better than the next one?
I don't think we are better, to be honest with you. And then I do believe there's industry that we're playing along right now that actually have really good companies. They have a good technology. I would think we're different because the approach we chose to launch the product. I wanted to focus on commercialization of exosome 5 years ago, rather than claiming a therapeutic potential of exosome. Because I've gone through the same FDA hurdles with growth factors 15 years ago. Mm-hmm. So I knew, and again, we've got written 483 many times. We've gotten visited by FDA inspectors that you can't say this, you can't say this, and we got many complaints coming from FDA. You can't say these stuff. You can't sell that product, right? That's where we started with the exosome. When I first looking into the exosome, because we knew as we have a process to culture the cell, we found out that there's an exosome that we can basically produce out of our process, that I have to do this differently. And then again, we have a lot of issues dealing with the conditioned media we talked about. Is the conditioned media what we thought to be a purified exosome? It's not really a purified exosome because there's a lot of stuff in the conditioned media if you were to culture the cell. Do you have a technology to completely filter out and then get the purified exosome? Answer is no. We don't have a 100% purification process. No one has it.
Are
right?
your exosomes the same as my exosomes?
Different.
So you have your own unique exosomes, correct?
Yes.
Some companies talked about exosomes from plants.
Yes.
Non-biological. And I've also read about exosomes from other animals besides primates.
Yes. And gets really interesting. And again, I know 5 minutes is not going to be enough. So in the process, right, I was looking at the commercialization. I decided to partner, as I said, with some other Korean company who were ahead of us in funding to set up a better facility for the pilot batch size, right? And also in technology, who've gone in and actually patent the process of filtering the exosome. And 3, who have technology who could also have gone through the trial error to dry freeze them in an easy way, a lyophilization process, which is very common in the pharmaceutical field.
Sure.
Right? Some people question about like, well, exosome can have the viability if you lyophilize it, but as you know, a lot of biologics, a lot of product that are out there, right? They are lyophilized. Botox, for instance, right? It is
Sure.
And then again, the unit measure is determined by the industry that FDA accepted it. So is that 100 units of toxin in the vial?
And that's how we deal with neuromodulators.
Yes.
So let's go back to exosomes.
Yeah. So exosomes the same way. So we were able to partner with the company, although we have a lab, we're tissue bank, we're FDA licensed manufacturer for the skincare. Someone better than us, right? That I'd like to partner with them to bring into the product that I feel confident commercializing, so that I don't have to have any legal issue based on it. I don't have any cost issues, that I can make the products.
So you're not marketing this as a drug?
No.
It's a cosmetic?
It's a cosmetic. That's a really good question because...
But your exosomes can be used on my skin, even though you and I do not have the same exosomes.
Yes.
I understand
because
you're harvesting...
Because it's not a cell, it's acellular. So
right.
Exosome is not a cell. Exosome is...
But you're harvesting it from fat cells, correct?
Yes.
From young women. Fat cells from young Caucasian women.
Age, not Caucasian women.
Okay.
Yeah, so we have a process in our cell bank to basically process different kinds of cell, but for this particular stem cell, master cell bank, we call it, is actually from Asian.
Okay.
Right? So there's...
And then you extract the exosome from that.
So you would culture the stem cell, in this case, mesenchymal stem cells.
Yes,
right?
From the adipocytes, correct?
Adipocytes.
Okay.
And Korea also has a process in place for government to regulate them.
Okay.
Here in US, you will do it, they will tell you, no, that's wrong. Right? In Korea, right, it's not a laissez-faire. They have to go abide by the government regulation on how to handle the stem cell. Right?
Okay.
And then even culturing process. Right? So that's a difference. So we actually decide to go with the cell that are being gone through under the regulatory review, making sure that these cells are free from all this disease and gone through the testing process. In US, most of tissue bank are supposed to do that as well, and they do it. So I believe they do it. But I felt that there's more trustability when the government regulates certain process.
So once this happens in Korea, then do you import it?
Yes. So way we do it is they go through the whole process of culture process and then again filter. We use the TFF versus the ultracertification. Many companies use a different method. But we use the method that would purify to the extent, right, that we could take out all the quote-unquote unhelpful stuff out of the way. Then we actually lyophilize it. So all the processes are done
You're
in
doing
Korea.
that in the States?
No,
You're
all the
Korea.
processes in Korea. It's a company called ExoCobio.
Okay.
They're 4th largest funded company in topic of exosome. So they already had this process in place. They just didn't know what to do with it. So they're going for the whole drug process with ADMET, right? They were doing toxicology studies, absorptions, metabolisms, and then again distribution in the body. But then they didn't know about the whole aesthetic aspect with the skincare. What I did is that I limit the therapeutic potential of exosome, and then make it into a product that I can commercialize legally. So well,
this is fantastic, and we could talk, I know, for hours, and I'd love to have you up in the studio. Since you're local, you're in Orange County, and my studio is in Manhattan Beach. I'd love to have you on for a full Technology of Beauty show. This is very exciting. And we all are going to be a part of this exosome journey. I can tell. This is smoking hot. This is breaking news here in not only in aesthetics but in all of medicine.
I do believe so, because obviously, like I said, this is going to be probably next 10 years, people's going to talk about it. But
Absolutely.
I can guarantee you now that there's not going to be a single company that will get full FDA approval as a drug or as a medical device, period.
Okay.
So then what's the way for doctors or anybody to utilize this product? Is skincare.
Yeah.
I told this to my competitions people. I showed them the way, how it's done. Very simple. You got to get your ingredient registered to the PCPC, get your INCI name, common sense, but people still don't do it. I've told some of them actually start doing it. And then you have ingredient list on your box so that doctors or consumer knows exactly what's on it. No hit and miss, right? That's the skincare. You can't just say topical. Topical what? Is it topical drug or topical membrane for the medical device? Or is it topical cosmetic, right? But if you're going to be a cosmetic, you better have, I know the cosmetic is the easiest way, you better have a proper label act, meaning proper claim on it.
Right.
And that's what's missing out in the industry right now. And then again, I was the first one who started, and then again, we have launched our product 3 years ago. We have list our products called human adipocyte stromal cell exosomes. That's the name of our ingredients that are listed, right? So anybody's welcome to use it if they're willing to pay me a royalty, because obviously we patent that as well too.
Of course you
So,
do.
but it's a public information, and then again, they can use it. If they can
Fantastic.
prove that they can actually do it a different way, they should do the route. And then again, I know the company come out with a conditioned media as an ingredient name, which is a good thing. But conditioned media is not exosome. Is exosome in the conditioned media? Yes. But the question is, what are the concentration, right? Because we're getting lyophilized, these tiny bits from 1 liter of conditioned media. We go through the same process, right? We're saying we're getting 1 box of exosome, but they're putting it into, right, into let's say 100.
So it's much more dilute. Okay.
Right.
Well, this could go on forever.
Yeah.
Thank you very much
you
for
very
being
much.
on the show and for joining us here in Park City at ABAM. And thank you also to Renato Salz, Dr. Salz, for allowing us to do this interesting interview. And I look forward to having you up in Manhattan Beach.
Thank you so much.